Hi, I'm Bernie Lieving. I am the New Mexico Statewide Overdose Prevention Education Coordinator for the New Mexico Office of Substance Abuse Prevention. I am not a state employee. I am a consultant contractor for the state, and I am the principal of the Lieving Group, LLC. I do overdose prevention and response education in all 33 counties in New Mexico with Pueblo and tribal communities. And I train anybody in the state 14 or older who wants to learn how to prevent, recognize, and respond to an overdose by using the overdose reversal drug naloxone. One of the things, I'm fortunate enough to be in New Mexico that acknowledged back in the late 1990s that it needed to codify harm reduction in state law and to mandate that the New Mexico Department of Health and its community-based proxies provide harm reduction services through overdose prevention education and naloxone distribution, syringe services whereby people could go to a syringe service site, exchange used injection drug equipment for unused injection drug equipment to minimize, especially at that time, our very high seroprevalence rates of hepatitis C. That was back in 1998 before we had a cure for hepatitis C. So we have a long history, over 20 years in New Mexico, of providing services for drug users in our communities. And I think we've been quite effective at doing that and identifying, based on data, areas of the state where we could concentrate our efforts. Most of the time, up until 2022, that was in our urban centers in Santa Fe and in Albuquerque and in Las Cruces. And in some of those larger areas, there are smaller villages and smaller communities surrounding those places where those services were taken to those communities. What we have found over the last 20 years, and particularly in the last few years, sort of since COVID, that what we used to see in those rural areas that surrounded urban or suburban areas, we are now seeing in rural areas with no urban or suburban area nearby. This issue of opioid overdose death has started to show itself in rural and frontier communities in our state. And one of our successes or our effective interventions over the last few years is we have expanded what would normally have been considered a sort of an urbanist or an urban-like kind of intervention to places where there may not be a pharmacy in the whole county, or to places where there is not access to harm reduction services in some of these super rural counties where it may take a number of hours to get to a place where you could get naloxone or get unused injection drug equipment. Having mentioned COVID, we have found that our remote trainings via Zoom or some other platform have actually helped us to increase local capacity. And that has been a very effective tool for engaging local community members in very rural and frontier areas, so that now we have people who can do what I do in a small village in a very underpopulated county, where they are seeing what we are seeing in the urban and suburban areas in their own communities, but now have local tools to be able to deal with that. That also includes working with Pueblo and tribal communities and doing remote trainings of trainers, and engaging those local communities has probably been one of my sort of favorite successes over the last couple of decades. Unfortunately, it was propelled by COVID, but we have had this simultaneous parallel track of COVID running side by side with increased overdose death. And since the beginning of the pandemic in our state, just over the last couple of years, each year we have jumped 200 more deaths per year during the pandemic. So in 2019, 605 deaths, 2020, 801 deaths. And it looks like preliminarily our 2021 data is going to show from that 800 jump over to 1,000, more than 1,000 now. Even though we have not been able to quite quell the deaths in any way that we have wanted to, we have been able to build community capacity to be able to address that with local community members who are known entities, who aren't from the state, who live down the street from you, who you can go over to their house and knock on the door and say, hey, you told me I could get Narcan here, and people be able to have increased access to that life-saving medication. One of the other things that's been a little bit disturbing over this number of years is that it seems to me that we have reverted to a more, again, if that can even be said, to a more punitive and draconian way of looking at people who are using drugs, street drugs. And part of my work, actually, back in the mid 2000s in New Mexico, we had this codified state sanctioned harm reduction program. I don't remember dealing with a lot of stigma and discrimination in the delivery of those programs and services that we were doing. But over the last few years, we have seen quite a jump in stigma and discrimination and dehumanizing perspectives from the public as it relates to substance use. And I believe that has also tied into a corresponding decrease in the sort of post-COVID social fabric. We are seeing large increases of people living on the streets in our communities who are living with serious mental illness without a place to live. Oftentimes they are using substances to deal with something that's undiagnosed, underdiagnosed, or not managed in behavioral health or primary care. And so the public has this perception now and has demonized and dehumanized and otherized people who use street drugs. And this has made my work over the last couple of years very difficult, and the work of my colleagues around the state, so much so that we have started doing anti-stigma, anti-discrimination presentations, not just to the public, but to law enforcement agencies and first responders. And by the way, not sharing my opinion about stigma and discrimination, but using peer-reviewed journal articles that have come about in the last few years that talk about the role that first responders and other community members can have in enhancing drug user health outcomes, just by treating somebody with a little bit of dignity and respect and kindness, dare I say. And certainly this can be tied, this sort of renewed stigma, this new renewed emphasis on punishment, this renewed emphasis on draconian measures for people using street drugs, could maybe find a safe place to be in an overdose prevention program, where they walk into the door and they are engaged with unconditional positive regard. They are not judged. They are not stigmatized. They are engaged as a human being who is more than the sum of their substance use. And although these programs are expanding potentially around the United States and have been in Europe and Canada for some time, the question remains as to whether or not the public of the general public in New Mexico would welcome a place like this in not only in their broader community, but in their neighborhood. I think one of the things that has been aligned closely with stigma and discrimination these past couple of years is this increased notion of NIMBY. And because we ostracize and otherize people who are using street drugs, any effort in a community to provide a day program for people who are living on the street is met with fierce resistance by community associations, by local businesses, and by homeowners. And I think one of the things that would be important for us to do as we think about moving forward with some ideas about how to create these sort of comprehensive one-stop shop of behavioral health and primary care and dental, and a place to take a shower, and a place to get your, get Medicaid figured out, a place to get some food, whatever, is a public education campaign that can help people understand that we are them and they are us, and that there is no separation. We are fellow community members. We all have intrinsic value, that people are more than the sum of their substance use, and figuring out ways to actually find a space. I think this might be the best advice I could give. Find a place in a community, in a neighborhood that is amenable to it. Start providing services there, and be able to show how community wellness has been enhanced, how public intoxication and public drug use has been minimized, break-ins have slowed down, and that you're engaging more and more as a community amongst all of us, and not just hiving us off in our own silos, in our gated communities or our locked up houses, and engaging in that way.